I am one of those people that went into nursing to help people, and I still feel that way. I still have the people connection. Everyone is my patient, my sister, my friend, or my neighbor.
I think when you are supported by your fellow colleagues, it shows unity, you have strength, more respected when you come together as an organized front.
SEIU nurses took the lead in promoting and protecting the Affordable Care Act, helping to make it the law of the land in order to provide access to quality, affordable health care to more Americans than ever before.
Nearly 1 million hardworking men and women could get health care if the few arrogant elected officials would let the House of Representatives vote on accepting Medicaid expansion in the state of Florida.
But if Governor Corbett makes the right choice, he can change that. By expanding Medicaid, he can cover hundreds of thousands of families.
The financial assistance that this law provides our mothers and babies enables them to receive the health care they sorely need and deserve.
Being a nurse, I've seen how the Affordable Care Act has improved health care. People now are coming more to the hospital than they did before. But doing this and showing support for these people, it shows that they're not out left alone in the dark.
As nurses, we continue to use our expertise and knowledge at the bedside and beyond to help address the rapid changes in the healthcare system today and to promote better quality patient care.
Trying to fight for everybody. I know this is not just in the NICU, it's everywhere. But if we don't stand together and do something about this, they're going to run us right over. And they will do it.
As frontline caregivers, we educate the public about infectious diseases to help keep nurses in our communities healthy and safe.
What is most important, we found, is that there is a core group that is trained over and over and over and over again.
I know the flu is not something that I want to get or pass along to others. There are a lot of misconceptions about getting immunized, but the facts are pretty clear to me. Getting immunized is easy and totally safe. It's all of our responsibility to do our part to keep ourselves and those around us safe from the flu.
Well, Colleen, one study says the attack rate on healthcare workers is actually second only to that of police officers nationwide. And many of the nurses we spoke with today say those numbers are probably actually even higher than that because many of those assaults are simply never reported.
We want to put our patients first, and if the corporations do not let us do our job and safely staff us, more people are going to get hurt. Patients will get hurt. Nurses will get hurt. Ancillary staff people will get hurt. Dietary services walking into this room could have been that person that was attacked by this patient. He didn't know what he was doing. He was hallucinating. The Swedish knew what they were doing that night.
When I was growing up, the Sisters of St. Joseph taught me, I am my brother's keeper, my sister's keeper. My parents' lesson for life was simply this: show up and do what's right.
And we believe that all work needs to be valued, and we also believe that every worker needs to be treated with dignity and respect. That's what we're about. We want people to really thrive, and we want communities to thrive.
For me, Pope Francis means compassion. I'm hoping that God is ever with this visit of the Pope, that they will understand that all human beings are equal and that we have to help each other.
I consider myself a nurse for Hillary. She plans to build on the existing act to improve health care for all people living in America.
I am for Hillary Clinton for president. She has always been for affordable health care for people, all people.
I have college-age daughters. They're going to be having children soon, and we just got to ensure that, the country is left in its best possible state as possible. And I feel that Hillary Clinton is the woman for the job.
SEIU nurses will continue to be on the front lines for our patients and our communities. And we won't stop fighting to build a better future for America.